I like numbers. Numbers are the tools that we use to judge how we're doing, not just focus group discussions. Not just focus group discussions. Numbers know, and numbers tell us, and I want to know whether it's getting bigger or smaller. Are there more or less of something? Not simply what do people think about it. And when it comes to children, we know that there's a number that's particularly important, and that number is 1,000. We have to pay particular attention to the first 1,000 days of a child's life, from conception forward. These days are crucial to their development and crucial to the person that they will become through adolescence and adulthood. And here I'm not just talking about nutrition and healthcare. It turns out that the physical, cognitive, emotional and social capacities of a child are inseparable. Young children who are in safe, stable, responsive family and community contexts that nurture their development have a significantly better adult outcome than those that don't have that care. To be clear, long-term studies have shown us that simple things like just cuddling your baby, talking or singing to it lead to improved lifelong health, higher educational outcomes, better resilience, more gainful employment prospects, peaceful relationships, and fewer behavioural issues. Sounds like a big win to me. The other side of the coin is the more than 270 million children in developing countries that fail to reach their development potential because of malnutrition, poverty, inadequate learning and social interaction opportunities, family violence, or being in a war or disaster zone. Add in that they most certainly don't have access to services to follow up on their health, cognitive and behavioural development, and you've got, yet again, the perfect storm, where the poor, disadvantaged and vulnerable are the worst affected and are likely to remain trapped by their poverty because of that circumstance. And society loses out on their potential. I've spent a lot of time in Afghanistan, and it's a beautiful country with fantastic people and quite devastating problems. After almost 40 years of continuous war, death, displacement and destruction of both human capacity and physical infrastructure, life is hard, really hard, and especially for the children. Only about 2% of Afghan families have access to learning materials in their homes. Discipline is harsh, and some 40% of children are left in inadequate care, often simply their older siblings, a year or two older. Over half of the parents in some provinces give children opium to keep them quiet, to settle them down. And almost 50%, 1 in 2 children, are malnourished. This results in one of the highest under-5 mortality rates in rural communities in the world today. Low school attendance, poor educational outcomes, which leads to poor job opportunities, a lack of innovative thinking, and poor parenting skills into that next generation. In 2015, World Vision started a project in Armenia with the support of the Bill and Melinda Gates Foundation. We call it Go Baby Go, as it's designed to test the effectiveness of encouraging parents to develop the skills that we believe are necessary to giving children the best start in life. We're testing this model in fragile states, and today I'm going to share with you our experience and our research in Armenia as well. Now, Armenia has a reasonably well-developed network of healthcare facilities and a lot of medical professionals spread across the country. What they don't have are early childhood services and specialists, and it's a throwback to communist times. Most healthcare workers are still focused only on the physical needs of children, on their health, nutrition, and protecting them from infection and disease. Of course, this is vital, but what isn't appreciated is the impact of these almost costless family interventions like playing and singing, reading to your children. Typically, they're not thought of as important aspects of childcare in Armenian culture. The majority of parents don't know or don't have the appropriate support from their family or community to have these skills, these soft skills. Parents think that children don't understand when they're talking to them, therefore they don't speak to infants. They don't tend to hold the baby because they don't want to spoil it. They probably leave them very tightly swaddled so their legs will grow nice and straight. Fathers mostly do not interact with their children, and we know that that's one of the key indicators for good children's development. Parents consider smacking or beating as fine as a method of discipline, and they don't worry too much about children being exposed to family violence or long-term conflict without adequate parental supervision. But we know that children are learners and collaborators from birth. When they're breastfed, when they have eye-to-eye contact, hear talking, singing, are shown love and affection, they blossom. If a baby isn't left to cry, if there's an effort made to show it colours, shapes and objects, if its parents talk to it constantly, explaining things, praising, playing, encouraging, all of this promotes a child's brain development and gives it self-confidence, trust, resilience, and an ability to go out confidently and explore the world. The research we undertook intended to explore the effectiveness of an integrated health, nutrition and early childhood development model on children under 3. We compared the results with a model that promotes only maternal newborn child health and nutrition amongst the same age group. We implemented this through 2 World Vision Area programs, Gava and Vardanis, in the Gegharkunik province of Armenia. We worked with the parents of 1,300 children, aged 0 to 23 months, living in 43 communities. So this is a substantial sample over a period of 14 months. During this time, the communities were given the extra Go Baby Go early childhood development package on top of the more traditional health package that the control sites received. There were 2 key platforms to Go Baby Go. The first was for the primary caregivers, normally the parents. And the second was aimed at primary health care providers to help them in counselling, screening and identification of issues. With the parents, the model was designed to enhance positive parenting skills. Specifically, it helped them to learn how to just simply play more with their children, how to communicate better and how to create a safer, more stable, nurturing and learning-rich home environment. We helped them to understand the need for and practice of hugging and holding, talking and touching, smiling, singing, sensitivity to their child's needs, protecting from violence, neglect and diseases, playing, reading, and thus providing that safe, nurturing and learning-rich home environment. We did this by forming and training community-based groups. That's educated women, experienced mothers, nurses, those kinds of people in the community. And we trained them as Go Baby Go facilitators. They then got in touch with mothers with children under the age of 3 and ran parental group learning sessions using the Go Baby Go curriculum. The sessions were fortnightly and each facilitator worked with between 10 to 12 parents, building their understanding of their baby's early development needs and how to address them, and helping them to strengthen their skills, their sensitivity and their responsiveness in caregiving. This training took in play and communication and prevention of injuries. It also looked at toxic stress, which can come when a baby is physically or emotionally abused or if it's chronically neglected. There are also the hazards of having a caregiver who's a substance abuser or mentally ill, or if the baby is exposed to violence and the accumulated burdens of family economic hardship without the adequate support of parents. Parents shared amongst the group any challenges and successes they had, and they were trying to introduce these techniques at home, and they discussed any other, perhaps cultural factors that they were encountering that were holding them back. They watched videos, they played games, they acted out scenarios, and they wrote and read to each other. And every session had a play-making activity, and the parents took the toys home with them at the end. They were also given homework assignments each week. The parents loved it, and attendance was as high as 80%. For those who missed a session, their facilitator would visit them at home, coming to see what got in the way of them attending and catching them up with what they missed out on in the session. In addition to the 4 Go Baby Go sessions, World Vision also organised 2 extra group sessions to remind and refresh them on what they'd learned and to cover new topics on managing common challenges like children having tantrums, which we all know, or difficulty sleeping or eating disorders. 2 other sessions were arranged that you might find interesting too. The first was for grandmothers, because we know how influential they are, with a 68% attendance rate, and the second for fathers, with an attendance rate of only 30%. Evidence that we need to consider more carefully the cultural factors that can be obstacles to getting fathers involved. We need to tempt the fathers into this space. The facilitators were also trained and monitored and given a chance to feedback on their experiences and their findings, and parents were asked to provide feedback on what worked, what didn't work, and what more they would like to see. The results. They showed a statistically significant difference between the Go Baby Go group and the control group in terms of early childhood development. About 71% of children in the Go Baby Go group scored high in the total composite score. That is for all 3 cognitive, motor and language subscales. The figure for the control group was 59%. In the 2 areas where the research was done, Vardanese has a higher rate of poverty. And here the effect was even more marked. Poorer children, were almost 4 times as likely to show better outcomes than their counterparts in the control group. 4 times. So these are results across 1,300 children in 43 communities. We reached mothers, fathers, grandparents, extended family members, and the results were equally good across all the different communities. And finally, let me just remind you how important this early care is. The research is rock solid. The prevalence of mental illness, stunted growth, obesity, heart disease, criminality, creativity, social tensions, literacy and numeracy all have their roots in early childhood development. The way we act towards our babies marks them for life, for good or for ill. And we can no longer afford to leave these things to chance, and we don't need to. Go Baby Go has shown that if we make the right investments in these first 1,000 days as a society, as individual parents, we will be paid back with the greatest dividends of our lives. If you want to know more about Go Baby Go or any of the evidence for change work that World Vision is undertaking, please visit our website, wvevidenceforchange.org. Thank you.